1880 to 1980, only 1,180 articles were published. So that means that our foundation for understanding this disorder, although maybe it was in the ancient Egyptian medical books, but not much research to understand it and to find ideal methods to treat it, have been explored over that 100-year span. But the good news is, if you look at the past 10 years, almost half of the total research has occurred in this span. And that's what we're seeing here. So this huge jump right here on the slide shows you the number of publications. Now, 2020, of course, it's not even halfway through the year, and it does take some time for the repository to catch up, but I feel very confident in saying that this number is going to increase. It's going to continue to grow. So our knowledge is growing, and I am very hopeful that we will know more about this and have better treatments in the very near future. So with that positive note, we'll go into what we do know a little bit about. So there are some risk factors that make you more prone to having tinnitus. If you are a person that has a job where you are exposed to loud noises, maybe you're a musician, maybe you work in a factory, maybe you are in the military, any of these types of jobs where you have a lot of exposure to sound, this can damage the tiny little sensory hair cells in your ears that transmit the sound from your ears to your brain so you can understand what you're hearing, whether it's speech or other sounds. And so when those are damaged from loud noise exposure, this can be a risk factor. Also, age. As we get older, we're more prone to getting tinnitus because the nerve fibers, they become detached with age. And when that occurs, again, the transmission is weakened, so that has been linked to tinnitus. For some reason, we have a higher incidence in males for getting tinnitus. Smoking is bad for everything, so if you're a smoker, all the more reason not to be. And we know that various cardiovascular issues such as high blood pressure, anything related to blood flow can cause tinnitus. Again, these are risk factors. And so a little more specifically of what we know is sound deprivation from that hearing loss. So when I mentioned that if you have some damage in those hair cells or the auditory nerve connection, it can mess up the sound processing along the auditory pathway. And so that's a big one that can cause this. Medications. There are various medications that seem to have tinnitus as a side effect. Unlike hearing loss, which there is no cure for hearing loss, once you stop taking the medication that may be causing your tinnitus, it often does subside. And also, as we already mentioned, exposure to loud sounds. Some people that have maybe a lot of stress or a period of time in their life that's extremely stressful, or you're prone to anxiety, even something as simple as needing to clean your ears or having congestion. Thankfully, when you fix those situations, the tinnitus will subside. Head or neck trauma, many medical conditions, and several unknown causes. So we're still learning every day about this. And I want to talk a little bit about the sound deprivation due to hearing loss because, well, like it or not, we all age, and almost inevitably in all of us, we will lose some parts of our hearing. This largely happens in the high frequency information, and as we get older, we lose more and more hearing. So I think this is inevitable. It's hard to avoid. Now, hearing loss does not always equate to tinnitus. That's important to say, but again, it's a risk factor. So some of the how this link has been established, there's a couple of things we know in the research, and I'm going to share some interesting ones with you. This study that came out was particularly interesting to me because they took otherwise normal hearing participants who did not have tinnitus and plugged their ears with, these, let's see, I have right here, these earplugs that, if you can see, that you can put in your ears, and they had them wear the earplugs for 7 days. And they were able to induce tinnitus because of the sound deprivation. And so that showed that somehow the sound deprivation, because nothing else was wrong, caused the tinnitus. And when they removed the earplugs, the tinnitus went away. And then another source of evidence that for this link is that often the frequencies of our hearing loss coincide with the frequencies that you're perceiving your tinnitus, or at least they're very similar to those frequencies. So as I mentioned, often when we age, we lose the high frequency hearing, and tinnitus is often in the high frequency range. And more evidence is those who have tinnitus and they use a hearing aid or cochlear implants to restore hearing. So they're improving that sensory input by way of a hearing aid or a cochlear implant. It helps to eliminate the tinnitus. Unfortunately, it doesn't eliminate it for everybody, but it does for many of those who use hearing aids or cochlear implants, at least while the device is on. So with that in mind, we'll go ahead and move into some of the ways that we can treat tinnitus, and also ways that maybe you should be an informed consumer and realize maybe it's not the ideal way to treat tinnitus. But first I want to say, the reason we don't have a cure is it's extremely difficult to understand, as I've already established in this talk. It's a very heterogeneous disorder, meaning that across people who have tinnitus, they may have different causes, they may have different symptoms. Everything that underlies tinnitus is not one aspect of it is simple. And in addition to that, as researchers, when we try to understand the pathophysiology or the mechanisms behind how tinnitus may occur, it becomes even more complex, and it likely involves peripheral and central mechanisms, meaning the ear all the way up to the brain in several parts of the brain. So I have here, I don't expect you to understand this, but I want you to see this is a complicated potential network in the brain. So this is not even accounting for peripheral mechanisms, but this is one mechanism by way of this huge network that could be contributing. So to walk you through what might be happening is you have in your brain stem, this part here sends the information up to the relay center of the brain that relays sensory information to higher order cognitive areas, in this case, that really help you to put together the information to say, this is what I'm hearing. And occasionally, you get activation of this middle part of your brain called the limbic system. And that part of the brain is often involved in emotional salience. So if something is important, it can activate your flight or fight response, or it tells you, pay attention to this. It's not typically a region that we think of is affiliated with sound. However, it very much is. And if you think about those who suffer from their tinnitus, perhaps this region is driving, as you can see, the interplay between this network. They're cross-talking across all of these nuclei. Maybe this is saying, hey, this is important, pay attention, and it causes the connections across these different brain nuclei to be strengthened, saying, I'm having an emotional response. And what does that do? It makes you pay more attention to something that's otherwise you could hopefully ignore. But when you're saying this is important, then it becomes harder and harder to ignore that sound. This region may also be causing memories. This is involved in making memories. So that in addition to the emotional component, it may just be strengthening the connections. When I say memory, cells have memories too in your brain, the way they connect to other cells. And if you're making those strong connections, then it's harder for us to go in with a treatment and do what we would say, induce plasticity to kind of undo those connections to get rid of the tinnitus. So this is, again, one of many potential networks that research has been implicating. So just to show it's very complicated, and this is why we don't have a cure right now. And because of that, and because many people suffer a lot, unfortunately, there are companies that take advantage of the most vulnerable who are really looking for a way out from their tinnitus. And again, I want to stress there is no cure right now. So anything that's claiming to have a cure, you should be wary about. And in fact, this beautiful article came out in 2018 it's easy to read, easy to follow, and it really drew attention to the fact that many of these treatments are scams. So I wanted to stress this to you because I think if you have tinnitus, it's important to be an informed consumer. So almost all of these treatments are going to advertise false claims that they will cure or relieve your tinnitus. And they often go as far as to lie and say that they're endorsed by ENT doctors. Even more sad is that the magazines in the waiting room of the ENT doctors often have these medicines in them because they pay to be in there. They pay for the advertisement. The ENT doctors aren't going to pay attention to something like that. It's just like any magazine, right? It's just the advertisements. And right there, you think this is a magazine in my doctor's office, it must be true. Well, it's not. And in fact, if you look closer at what these medicines have in them, you'll often see that they're made of the same ingredients you can find, say, at Walmart in other general vitamins and minerals at way cheaper cost. They charge upwards of 5 to 7 times more the cost of what you can get at Walmart or any drugstore just because they put the label that it's marketed for tinnitus on there. So if you did want to try it, at least look for a cheaper alternative for the same ingredients. Another important point I want to mention is that there's actually no regulatory procedures that the FDA requires for over-the-counter supplements. So if you were to get a bottle of one of these treatments and they have some ingredient that's supposed to be the effective ingredient to treat, if you were to compare how much of that ingredient is in one pill versus the next, it's probably going to vary a lot because there's no regulation, there's no quality control. Also, they may be sitting in warehouses for months at a time, and it can cause the medicine, the treatment to degrade or even interact with the other ingredients in the bottle, and this can render them ineffective or even toxic. And if you have an allergic reaction to one of these ingredients, or perhaps they might be working against some of your other medications, that can be dangerous too. So I don't want to say to take away hope here because, again, we have no cure. So there's nothing wrong with wanting to try things, but the important point is to be informed and always ask your doctor if you're unsure. And now with that, I want to go into what we have a little bit more promise in. So some of the exploratory therapies in tinnitus. Often a doctor can prescribe anxiolytics or antidepressants, and this can serve to help to alleviate some of the response that you're having in dealing with the management of your tinnitus. So it can help to make it seem less annoying or less bothersome. And also sometimes if your tinnitus is due to anxiety and you were to get it under control early after having tinnitus, perhaps you can get rid of the tinnitus altogether. We do know, however, the longer you've had the disorder, the harder it is to treat it. But, and also anxiolytics and antidepressants have been, unfortunately, also linked to causing tinnitus. Steroids are another treatment. These are short-term treatments that can be effective, but they have side effects of their own and should not be taken long-term. Your doctor may also want to take an alternative approach, again, because tinnitus is so variable across individuals, they may feel a different medication might be better for you. So antihistamines, for example, can be used sometimes. And as I mentioned about how much we are learning in our research on tinnitus, we are starting to develop new drugs that can target intracellularly in the brain. So very, very specific parts of where maybe the tinnitus could be going wrong, or neurotransmitters, or different more specific targeted drugs for tinnitus. So be on the lookout for new drug development. Also, psychological or behavioral therapy can be helpful. And this is going to help not so much with getting rid of the tinnitus, but helping you to deal with the burden of having it in a daily life. So how to deal with your emotional reaction to it, how to manage it, how to get rid of your anxiety and depression that may be caused from your tinnitus. Also, self-care is important. So a psychologist may subscribe, may suggest to you to practice meditation or yoga. And these have been shown to be effective to help with tinnitus management. Now moving to a little bit more innovative research, and some of you may have heard about this, but vagus nerve stimulation. This is where you have an implant in your neck on your vagus nerve, and it's paired very specifically. It's coupled with sounds. So the sounds are paired with the impulse from the stimulator, and it allows brain plasticity by precisely timing this neurotransmitter release that occurs as a result of stimulating the vagus nerve. So as I said, we have these strong connections that perhaps are difficult to override. And if you want, and that might be causing the tinnitus, and if you want to break apart those connections and make the brain do something different, the vagus nerve is a way to hijack the system and allow it by precisely targeting by way of the stimulation and the sounds to help to have some more, to change what the brain is doing to respond to hopefully mitigate the tinnitus. And another wonderful side effect of vagus nerve stimulation is it's known to also relieve stress and anxiety. It gives a calming and relaxing effect. So in addition to possibly treating tinnitus, it can also give some anti-anxiety, a remedy for anxiety as well. However, it does require surgery. And this does not work for everybody, as all of the treatments, unfortunately. Another treatment is transcranial magnetic stimulation, and this is non-invasive. And this works by putting magnets around your head, these big magnets, and they're able to excite the neurons in your brain by rapidly changing their magnetic field. So you can induce plasticity in a similar way by using the magnets. However, this is a little bit more difficult to control because it is newer. It's researchers are working to try to figure out the ideal parameters for this. So some of the methodological issues are still unresolved. For example, should we stimulate on one side of the head or the other side or both? Do you want to stimulate in ways that causes more inhibitory response or more excitatory response? This will depend on the brain regions that you want to target. So there's a lot that still needs to be worked out with this, but it's also moving in a positive direction for treating tinnitus. And now I want to move into what we're doing in the Hearing and Speech Lab at UC Irvine to treat tinnitus. So we're doing acoustic stimulation and electric stimulation. And first we're going to start by talking about acoustic stimulation. So this is really easy. It's non-invasive. It's something you can inevitably do at home. You just have to have some earphones or something that can play sounds. And the sounds are able to either cover up the tinnitus, in which case you're hearing another sound, but some people find that the new sound is less bothersome than the tinnitus sound, or it can outright eliminate the tinnitus. So you listen to the sound long enough and it causes a drop in the tinnitus. So what we don't know about acoustic stimulation is what parameters are most ideal across individuals. So perhaps some sounds are better than others, and maybe this varies depending on the person. So in our lab, we are basing it on previous research where we know some of these sounds seem to be more viable than others, but we control to test as many as we can. So we do these pure tones or single frequencies, and we can change the frequencies from low, medium, or high, and we can amplitude modulate those frequencies, or we can frequency modulate the sounds, or we can play a narrow band noise or a white noise, and see if any of these are better at masking or suppressing the tinnitus. And what we have found, and what others have also found, is that when we use the modulated sounds, so the amplitude or the frequency modulated tones, it's much more likely than white noise. So this is showing the graph here is across frequency, lower frequency, higher frequency. Here's the different types. So the white noise being the gray bar, it doesn't really change across frequencies, but as we increase the frequencies, the higher frequency treatment does better overall, and it does especially well with the modulated frequencies. So this research is starting to show us that if we're going to try to develop treatments for people, perhaps we should be looking at treating higher frequencies with higher frequencies and using amplitude or frequency modulated sounds. But that's great if you can hear high frequencies. But if you recall, I told you earlier that many of us start losing high frequencies as we get older. So what happens if you have some hearing loss? Then if you can't hear the sounds you're being used, that are being used to treat you, then obviously that's probably not going to be an effective treatment. So given that, the principal investigator in our lab, he is a renowned expert in cochlear implants, and he is realized over the course of his research in cochlear implants, and others have also come across this, that cochlear implants, one, can activate detached neurons when sounds cannot. So if you have the damage to your hair cells, you can bypass that with electric stimulation and still get the sound to be processed. And two, people who get cochlear implants often report that their tinnitus is improved. Again, not always, but often they get a reduction or a complete removal of the tinnitus, at least while the device is on. Now, getting a cochlear implant is invasive. It requires a surgery and an implanted device. And also, you wouldn't even qualify to get a cochlear implant unless you had severe to profound hearing loss that cannot be treated with hearing aids. So it's not a very viable option for those suffering from tinnitus if they don't have severe hearing loss. Also, currently, cochlear implant devices are meant to improve speech perception. They were not created to fix tinnitus. It kind of was a nice byproduct that it also can help. And that's what got people like the principal investigator of our lab, Professor Zhang, to say, hey, maybe we can come up with something that's similar for people who don't qualify for a cochlear implant. And also, if you do, perhaps we can find better parameters that are meant to target tinnitus instead of speech perception. And this is a good way to go, because a lot of people who have tinnitus, they might have little or no hearing loss. Therefore, they don't want to get a cochlear implant, but perhaps acoustic stimulation did not work for some reason for them. If cochlear implants are not ideal because they're, as I said, invasive. They're also extremely expensive. And if you do have some hearing, it will destroy your hearing. And even though a cochlear implant restores some of that hearing, it will never be like it is with normally. So you won't have the resolution that you have. So it's something you probably don't want to do if you don't have to. So we really do need to think about this non-invasive electric stimulation as a treatment that can suppress tinnitus and still preserve the hearing. And so in our lab, we are using non-invasive alternating current electric stimulation. Other labs have looked at, say, direct current. Both are very safe, but alternating current seems to be even safer, so that's why we're looking at that method. And it can stimulate those detached auditory nerves, and it's also able to target deep structures. For example, the auditory nerve, if anyone wants to feel this bone behind their ear, is called the mastoid. that is the densest bone in your skull. It's very difficult to get through that. And this electric stimulation is able to actually bypass that and activate the auditory nerve. And I should have cited the paper here, but our lab recently published a paper in 2019 showing how this was quantified, that activation of the auditory nerve is possible by this way. And of course, it avoids the side effects that can happen from drug treatment. It allows us to vary different stimulation parameters, so we can change the frequencies that we're stimulating with, just like we could with acoustic stimulation. We can change the intensity, so how strong we're passing the current through. We can change how long we're stimulating for. We can use different types of electrodes. So this one would be more viable for somewhere on your head where you have hair and it's hard for these to stick. This is for your eardrum or ear canal, sorry. And this is for anywhere you don't have hair, such as that bone behind the ear or the forehead or the temples. And here's a picture of this, the one that goes in the ear and the one that goes behind the ear. And we can even target the eardrum itself. So this is an electrode going right up against the eardrum. So we can play around with the various placements of these electrodes, and that will help us to target different brain regions, and it helps us to have more options that may work for one patient better than another, depending on perhaps what is causing their tinnitus. So I'm going to show you very preliminary results from some of the work we're doing in our lab, but because it's unpublished, I'm not going to show much. But what I do want to show is that, thankfully, a lot of participants do experience a reduction in their tinnitus with either acoustic stimulation, so the sound stimulation, or stimulation of the electrical stimulation when we put the electrode at the eardrum. We get a little bit when we put the electrode at the ear canal. So these are the three ways that we're seeing that are the most promising. Responders means those who are able to report that a change occurred in their tinnitus. So if we're able to modulate that tinnitus somehow, it means that we are activating something that is likely involved with the tinnitus. So this is really good if we can change their tinnitus percept. And in most of these cases, I don't have the data here, but changing means reducing the tinnitus. And in some cases, changing could be if they just hear a different sound. But a lot of the time, and that's our goal, is to reduce or even eliminate the tinnitus. And to be a little more specific here, I'm showing yellow is the sound stimulation, and then the red again is the ear canal electric stimulation, and the blue corresponds to when we have the electric stimulation at the eardrum. We have responders again here, and you can see that they vary as far as which ones do better when. So this is why the research needs to really look deeply into this, because it's not as simple as one catch-all. It is not as simple as acoustic stimulation works for everything. We find actually that acoustic stimulation works best for when we use high frequency stimulation. That's better when we do acoustic stimulation. So those that still have their higher frequencies preserved, this might be a better treatment. Whereas those that perhaps have lost some of their hearing loss, maybe using lower or middle range frequencies to stimulate and doing it with the electric stimulation specifically at the eardrum seems to be the more viable option. So that's the preliminary data that I'm going to show, because I do want you to know that our lab and others are really working hard to try to find ways to treat the tinnitus. And in fact, we are recruiting participants. So anybody who is suffering from tinnitus and may be interested in trying one or more of these treatments, we are happy to have you. Our lab is also doing a lot of other research. So if maybe you don't have tinnitus or you're not interested in participating in those studies, we have other studies looking at sound sensitivity. So if maybe you are a person that finds sounds to be louder than everybody else, and maybe it's very uncomfortable, we have studies looking at that. We have studies looking at how tinnitus may affect speech perception. And we also are moving in a new direction that we are trying to find out more about this link between hearing loss and age-related cognitive decline. So the number one reported correlated measure, if you look at, say, visual decline, which happens with age, our cardiovascular system, a lot of things decline with age. It's just a part of life. For some reason, when people studied all of these different these different aspects of aging, they found that hearing loss was the number one correlated measure. Now, correlation does not mean causation. So we're trying to investigate whether or not it does mean causation, and if it does or does not, we're trying to understand what does that mean and also ways to treat that. So as I mentioned, there is no cure currently for hearing loss, just like there's no cure for tinnitus. But there might be ways, if we can understand which part of hearing loss could be the problem. So that we're looking at figuring that out in treatments for that as well. So there are a lot of avenues. If you're interested to participate and learn more about auditory research, we would be happy to have you. Because this will be broadcast on YouTube, I don't have my own contact information, but Tony was nice enough to offer her email address. So if anybody wants to send her an email, she will get you in touch with me. And once the coronavirus has subsided enough that we are allowed to recruit, I will happily get you in to our lab for an assessment and to talk to you more about anything you may be interested in. And with that, I would like to open the floor up for question and answers, and also leave the slide for acknowledgement for my lab members, UC Irvine Center for Hearing Research, who sponsors me with this training grant, and of course, my mentor, Professor Zhang, who I couldn't do any of this without him. So thank you very much for your time.
Okay, gonna send a poll, launching a poll, and if you're interested in participating in the laboratory with Dr. Kapolowicz, just indicate yes or no. And okay, I'm hoping that when I go into this, okay. We do have some questions. I'm hoping I get the names of people. I just see yes or no. Is there an ear exercise, especially physical or physical therapy, to minimize, eliminate, or even prevent ring or buzzes in the ear?
That's a great question. And to my knowledge, there's no exercise that you can do, but what you can do is prevent yourself from being exposed to loud noises. Maybe don't use the earbuds so often. If you do use the earbuds, if somebody next to you can hear it, that means it's too loud. Also, as I mentioned, acoustic stimulation, I believe, has been approved by the FDA as a treatment. And the problem is the sounds that will work, that you play for yourself to minimize, it's going to vary. So you will have to explore. There are apps out there on your cell phone that you can download. Maybe you can buy those devices that play sounds. But if you play around a lot, you might get lucky and find a sound that works best for you. Unfortunately, we don't know enough to say this sound works for everybody. But yeah, so it's not so much exercises, but one, finding a treatment that helps you to suppress it, and two, protecting your ears from sound.
Okay. Another question. A gentleman says, I have cochlear implants. Sometimes when I'm about to sleep, I could hear background people conversation that is not discernible. Is that tinnitus?
If it's actual conversation of people and it's just muffled, no, that's not. Tinnitus is a sound that is coming from somewhere in your head. It's nothing outside that's causing it. Yeah.
Okay. What about notch therapy that is used by Signia? That's a hearing aid manufacturer. Do you know anything about notch therapy?
I'm not sure. I think if that's where they're playing sounds and is specifically related to maybe where you have the hearing loss, yes, sometimes that therapy can work. So yeah, the hearing aid companies they're actually moving forward a lot with trying to do things like treating tinnitus, and they're getting very innovative with Bluetooth and everything else. So yeah, it's if you have that, it's worth trying, but it doesn't mean it will work for you, but it may work for somebody else.
Okay. Have you looked into using the Widex hearing aid Zen sounds for your study? They have a large variety of fractile tones to choose from, of varying spectrums. The hearing aids would produce sound near the eardrum.
Yeah, we're currently in our lab, we're I could say kind of mimicking things like this, where we play around with similar parameters like that. And yeah, the good thing about the hearing aids is you can do it right up against the eardrum, which is perhaps better. But because hearing aids, we're not using hearing aids specifically in our lab, and because they can be very expensive, so we're just right now just looking at, generally speaking, sounds that somebody can hear if they have headphones, and maybe they use an app or something. But for people who qualify for insurance or whatnot and can get those hearing aids, then sure, that's a good idea. Yeah.
So I still have a couple of questions here, but before I get to that, if you have a question, please use the chat feature in the bottom there, and you can just type out your question. We actually have some comments as well. Or here's another gentleman. Would a steroid injection help the ear?
Okay. Yeah. So often, so I am not an ENT doctor. I'm a scientist, so I am in no way want to give medical advice in that regard. But I do know that steroids are given sometimes when people do have tinnitus, because if there's any kind of swelling going on in the ear, steroids can help to minimize the swelling. And by minimizing the swelling, it has that kind of side effect that it will get rid of the tinnitus if the tinnitus is caused from the swelling.
Is there a sense of pressure in the ear typical with tinnitus?
Absolutely, it can have a sense of pressure. Not for everybody, but for myself, when I have tinnitus, I always have it accompanied with the pressure, but not always.
Okay. So there's a question here about earwax, but that's really not the topic today. Unless you feel like you want to address it.
What is the question specifically?
Is earwax removal needed? And how would you remove and clear the ears?
The proper answer to that is having a doctor do it professionally. Yes, you should remove it, and you should have a doctor do it with the proper tools and very carefully. We are told you should never use Q-tips or any of the things we probably do anyway. I myself am guilty of using Q-tips. But to give you the proper answer, you should get it removed from your doctor, because using Q-tips, you're pushing a lot of it further into the ear instead of removing it. And so over time, it's building up more, which can definitely lead to tinnitus. So if you think the earwax is causing the tinnitus, a doctor can remove it to see if that's the case.
Okay, we have somebody here from Manitoba, Canada, and who just stumbled across this group. Just doing that search. Does the lab work with Canadians? Also, does the lab look into things or problems that could be causing the tinnitus, like TMJ problems, for example?
Sure. Our lab is not looking into that. And in my slides, I listed some of the common causes, but often when we have people that, and I say causes lightly again, these are just correlated factors, but we, for example, a lot of people that come into our lab tell us that they'll have TMJ as well. And interestingly, speaking of the jaw, some people can modulate their tinnitus by moving their jaw, moving the mouth up and down. another way to possibly treat your tinnitus. Yeah.
Can you share about when you hear music playing in your ears?
Well, all I can say about that is it's a very, very minimal percentage of people who experience tinnitus experience it in a melodic sense. And as a result, it's not as well understood or researched. I personally don't know enough about it to speak, so I would maybe not feel comfortable answering beyond that.
Okay, we have a question from Lisa, but she's on the phone, and I'm going to unmute her.
Okay,
Thank you.
Lisa? Hi,
Yes, thank you.
question?
I do. First of all, thank you for being here. That was so much good information.
Oh, thank you.
I happen to be a former tinnitus sufferer, and I just want to make sure that everybody out there knows that the work that you're doing is not only worthy and beneficial, but it actually does work. Are you familiar with the Sound Cure Serenade that was developed there?
Yes.
Are you still offering that?
I think they are trying to get it to be able to be back on the market again. I forgot, my boss actually talked about this a little bit, and I forgot what he said about it, but I know that it was very effective, and and a lot of the sounds that we use are come from what worked well with that.
Right. I'm sure what you're doing is probably very similar, just under a different title, but people should know that it really does work.
Yeah.
I worked for an audiologist that actually prescribed it and used it for patients.
Wow.
And having had tinnitus myself, I can tell you that there are solutions, whether it be the electronic impulse or the melodic sounds. For me, it was low resonating woodwind instruments, and that was the tune that my brain liked. So you don't have to suffer. Finding solutions, and I think it's great.
Okay,
thank you so much.
One, because we're running a little overtime, but the captioner is willing to stay a little bit longer. This is from Ty. I've used several apps, but none actually slowly modulate the amplitude. What apps do you suggest? I ended up using a hearing aid with amplitude modulated notch sound matched to my high frequency. Is there a more suitable distraction?
Well, so that one is often thought of as what would be the most ideal case, but I don't know what this person's experience was, whether or not it worked for that person. I'm assuming if they're asking, it did not work, but for most participants, if you look at the majority of them, that would probably, if I had to speculate, would be the most ideal case. But as you know, this person mentioned, it doesn't always work for everybody, and some people may need a completely different sound that's not related to their tinnitus. And that's why that's what we're trying to better characterize in our lab is maybe different types of people that have different experiences with their tinnitus. Maybe they respond better or worse to certain kinds of sounds. So we're still trying to figure out who's maybe a candidate for this treatment, or who's a candidate for that treatment. The answer is still unknown, and so unfortunately it's trial and error right now.
Okay, another comment here from Seattle. Is there a place to find references to labs who are doing similar work in different parts of the country? So I guess you have a network somewhere that you...
Well, just doing general searches online will usually pull up a lot of the universities that may be posting any of the information. Our study is listed on clinicaltrials.gov. So if you go to the clinicaltrials.gov for the United States, that often will list a lot of them that you can see. Those are specific to clinical trials, however. So to get to that level usually requires research that's going on beforehand that you can certainly participate in, but it might be harder to find that. The best way is usually through word of mouth, or your local audiologists or universities that may be doing some research can get you in touch with people across the country. In a lot of these cases, the places will pay you to go do the studies, even depending on what the study is.
Okay, well, Cheryline, thanks you so much for your informative presentation.
Thank you for listening.
Anybody else? One more. Okay. Okay, I was expecting this one to come in. It came in late, came in last. Please ask, which hearing aids are best to help with tinnitus for high-pitched tinnitus due to hearing loss? Only at the very high end of the spectrum.
I don't have the answer to that because I'm not an audiologist, so I would defer that question to an audiologist because they would certainly know better.
Hold on just a minute.
Mm-hmm.
Ann Mundell, do you have an answer to that question? Hello, Ann? Okay, she's here, but she's not here. Okay. Ken Post, do you have an answer for that?
The hearing, many of the brands have different approaches to tinnitus. I had asked a question on the notch therapy where they actually don't amplify the frequency at which the tinnitus is acting up in the person's ear. And it's kind of like you said, it's hit or miss. What works, sometimes people say that's worse than tinnitus itself. Some people say that's helping. You just have to try, like each brand seems to have some different options. You just try those and see what may or may not work for them. But what Widex does versus Signia, some of it's similar and some of it's very different. It's nice that you have a lot of different options because we can try that for someone who, if they're particularly bothered by their tinnitus, we have a lot of different options to try in different brands.
Thank you, Ken. Barry Goldberg, I would like you to tell everybody about your tinnitus group.
Hi. Can you hear me?
Yes.
Okay, hi. Well, my tinnitus group has been around since 1998. It's the Orange County Tinnitus Support Group. And right now we're not meeting because of the COVID-19, but with your inspiration, Tony, I'm going to be going to doing Zoom meetings myself starting next month. And I really appreciate you all for this wonderful meeting. And anybody who wants to know about my meetings can email me at bargold06@yahoo.com. And I will put you on my list to be informed of when the next meeting will be.
And if I'm not mistaken, you're going to learn how to Zoom and you're going to have Zoom support meetings.
Right, Kevin at the ATA is having a meeting for all the support group leaders to teach us all how to handle a Zoom meeting, which you are doing wonderfully. And I really appreciate being invited to your meeting.
Okay. All right. I don't see any more questions. I think we're going to wrap this up. Thank you so much. Dr. Kapolowicz, I have to look at my phonetic way of saying that.
You are fine.
I'm gonna good. You know, you got to hear it well to be able to pronounce it too.
Yes.
So,
yes.
You know what? There's one other person I would like to ask to comment. Tracy Dorr. Tracy, would you like to comment? Because I know you've worked with the doctor before.
Yes. And to help improve my speech understanding. Wonderful group of people.
Thank you, Tracy.
Thank you. Actually, we're going to invite Dr. Kapolowicz back. There's a variety of topics that she can speak on. She and I have been talking about hearing loss and dementia, cognitive decline. And what other topics do you enjoy talking about?
I'm always interested in anything that has to do with what I say is auditory learning and memory. So anytime you have a difficult listening situation and you are able to overcome that, how is that possible and what makes that difficult or impossible to overcome, such as hearing loss? So if you have speech and noise, or you're listening to somebody who has a foreign accent. Any of these kind of these processes that require you to adapt to a signal that's different than what you're expecting a nice clear signal to be, how we can adapt to that and understand, but also where that might go wrong. So anything that relates to that, and then also, as you mentioned, I'm starting to do, we're doing very new research in the lab on the link between hearing loss and cognitive decline.
Wonderful. Okay, I am going to send, may I send out your PowerPoint presentation?
Absolutely, yeah, sure.
Okay, so I'm gonna figure out how to do this. This is all new to me. There's a lot to learn to get this down smoothly. I've made some mistakes already today. One thing for sure, I intended to record this session, and but I got it started late, so it's not complete. Now I can't find how to pass a chart to you, file to you. Let's see. Okay, I'm going to put it on the website, hearingwellclub.com, www.hearingwellclub.com, and if you would like to get a message to the doctor to answer your question, please send it to me and I'll make sure she gets it and she'll get back with you. So that's info@hearingwellclub.com. Okay, thank you so much, and we'll see you again in the fall, I hope.
Yeah, I'd be happy to come back. Thank you so much for having me.
Thank you so much. Bye-bye.
Bye.